Welcome back to my channel. So we are going to discuss about vital signs. Do visit to my previous lectures of oxygenation needs, and now let's start with one of the most important chapters, that's vital sign. So without wasting your time, let's start. And do like, share and subscribe if you found the video helpful. So what do you mean by vital signs? So vital signs are the clinical measurements that indicate the essential body functions and reflect the person's physiological status, including temperature, pulse, respiration and blood pressure. So अगर in simple words we can say that we can check that person is healthy or not. We can check that he is means maintaining his health or not. उसकी तबीयत तो नहीं ख़राब है. Like vital signs तभी altered होते हैं जब person is ill. And temperature, pulse, TPR, BP is our vital signs, and oxygen saturation and pain are also added as vital signs. So let's see the vital signs and its normal range. So respiratory rate 10 to 20 breaths per minute, and if we have bradypnea then we have less than 10, and if we have tachypnea then we have more than 20 beats per minute. And oxygen saturation is the oxygen present in our blood that is moving in our body. That's oxygen saturation. It is measured by probe, SpO2 probe, oximetry we say. And 95 to 100% is the normal range, and less than 95% equals to hypoxemia. Blood pressure systolic 90 to 120 and diastolic 60 to 80. Hypotensive low BP, hypertensive high BP. And heart rate 60 to 100 beats per minute. Bradycardia we have less than 60, and tachycardia we have more than 100 beats per minute. Temperature, you all know about normal range: hypothermic, normothermic and hypothermic, hyperthermic. And pain is a subjective. It can be numerical or Wong-Baker scales. So let's start with vital signs according to syllabus. Guidelines for taking vital signs. So what are the guidelines for taking vital signs? So these are also the parts of vital sign. In notes you can write. So body temperature, we all know कहाँ से हम body temperature को measure कर सकते हैं. तो that's from oral, rectal, axillary, tympanic, temporal sites, etc. Okay. And in abnormality we have hyperthermia above normal, hypothermia below normal range. Now pulse, its heart rate. We will be discussing these all in detail. Abhi to we are discussing in short because we have these topic in vast. So normal adult rate is 60 to 100 beats per minute, and common sites are radial, artery, carotid, brachial and apical. Apical, most common site is taking for pulse is radial artery. So abnormality we have tachycardia more than 100 beats per minute and bradycardia less than 60 beats per minute. Now let's see respiration rate. So normal adult rate is 12 to 20 beats per minute. It's assessed by observing chest movement. When we take respiration rate of the patient, we never inform that yeah we are taking your respiration rate. अगर हम कह देंगे उसे कि हम चेक कर रहे हैं तो वो ऑल्ट्रेशन करने लगेगा. सो इट्स अ नॉर्मल प्रोसीजर. लाइक जब हम वाइटल साइंस चेक करते हैं TPR BP, सो सीक्वेंस में हम करते हैं तो विदाउट टेलिंग वी जस्ट count his respiration rate. So tachypnea, it's rapid breathing. Bradypnea, slow breathing. Apnea, as the name suggests, apnea. A for apnea, A for absence of breathing. Now we are having blood pressure. Normal adult values 120 to 80 mmHg. Measured with abnormalities, you can see hypertension and hypotension. So yeah, you can write these all in your notes. So additional vital signs, as I told you earlier, oxygen saturation normal is this, and pain is the fifth vital sign. It's considered level of conscience, sometimes considered a vital indicator. So what are the guidelines for taking vital signs? So prepare the patient, explain the procedure to reduce anxiety, ensure the patient is comfortable, relaxed and rested for at least 5 to 10 minutes. Means we have to first provide we have to first of all हम explain कर देंगे procedure ताकि patient को कोई anxiety ना हो. फिर हम ensure करेगा वो patient जो है comfortable place पे है, relaxed है और rest है, और जैसे कि वो कहीं से दौड़ भाग के नहीं आ रहा हो, क्योंकि अल्टरेशन कर सकता है वाइटल साइंस में. अगर पेशेंट कहीं से मतलब कॉफ़ी या कुछ ड्रिंक करके आ रहा हो या मीन्स भाग दौड़ के आ रहा हो, तो वी हैव टू मेक हिम सिट फॉर 5 to 10 minutes. चूजिंग द करेक्ट पोजीशन अकॉर्डिंग टू मतलब जो भी हम प्रोसीजर कर रहे हैं TPR BP. इनमें से, तो फिर वी अकॉर्डिंग टू दैट वी हैव टू असेस द करेक्ट पोजिशन. देन environment, we should make sure that environment is quiet and comfortable with room temperature. Ensure privacy and dignity of the patient. What are the equipments? Use clean, accurate and calibrated instruments. So what are the instruments? That's thermometer, sphygmomanometer, stethoscope, watch, pulse oximetry. Check for any faults or damage before use. We have to always ensure that our instruments are working properly or not. Then what are the techniques? So follow the correct procedure for each vital sign. Always use the same site and method when comparing readings. Avoid hurried or rough handling. Do not use a site that is injured. Yeah, it's very important. Like जैसे कि हम ब्लड प्रेशर ले रहे हैं और उसको प्लास्टर हुआ है, IV कैलुलर चल रहा है, या उसका ब्लड सैंपल अभी लिया गया है उस हाथ से, so we have not to take blood pressure from that hand. Okay, I hope you understand. So do not use a site of injured. Timing, take vital sign at regular intervals. Routine observation, record before, during and after procedure, surgery, medication if required. Measure at the same time each day for comparison. Accuracy, do not rely on estimation. Count full time, full 1 minute for pulse if regular. Like sometimes pulse we take for 30 seconds only, but no, that's not the correct way. First we have to measure for, if he is a patient, then we have to measure for 1 minute whole. Accuracy, and avoid measuring BP immediately after exercise, eating, smoking, emotional stress. Like these can alter the blood pressure. Like emotionally the patient is having some problem, so we are not taking BP at that time. Like he's smoking, smoke करके आया patient, then we don't have to take, like खा के आया है, exercise किया है, so we don't have to take BP at this time. Recheck if the reading is abnormal before reporting. Now it's very obvious, recording and reporting are very essential part. So record immediately in the nursing chart or the patient file. Note the time, site, method and patient condition during measurement. Safe and infection control. Wash hand before and after procedure. Use disposable covers or clean equipments between patient. Follow for universal precaution to prevent infection. So in short, if we say, like while taking our vital signs, always ensure patients correct equipments, proper technique, accurate reading and timely reporting. So yeah, that was that. Now let's see body temperature. Now we are coming to our first vital sign in depth. As I told you earlier, that's body temperature. Body temperature is the balance between the heat produced by the body, mainly through metabolism and muscle activity, and heat lost from the body through skin, lungs, urine and feces. What is the normal range? So this is the normal range, you can write, and it reflects the body ability to maintain homeostasis. So hope you understand the definition of body temperature. Now we are proceeding toward physiology of body temperature. So heat production, there's thermogenesis, occur mainly in liver, skeletal muscles and endocrine glands. What is the sources of heat production? is basal metabolic rate से heat produce होती है, muscle activity से, shivering से. जैसे BMR जब increase होता है तो heat production होता है. Hormones like thyroxine, adrenaline, sympathetic stimulation से. And heat loss किससे होता है? Thermolysis जिसे कहते हैं. Occur mainly through skin. जैसे कि हम लाइट चली जाती है तो sweating होने लगती है. Lungs, urine and feces. Mechanism, what are the mechanism of heat loss? Like radiation, conduction, convection, evaporation. These four are very important, so understand with all your focus. Radiation, transfer of heat to surrounding air without contact. In this there is no contact between the object. Transfer of heat to surrounding air without contact. Conduction, transfer by direct contact. Conduction में direct contact से transmission होता है. Convection, heat lost by air or water movement. And evaporation, sweating, moisture lost from. Now we are having regulation of body temperature. How body temperature is regulated? So it is mainly controlled by hypothalamus, the body thermostat. Heat produced and heat lost are balanced to maintain a stable internal temperature. Mechanism and regulation. So now let's proceed. When body is hot, तो वास्कोडाइलेशन हो जाता है ऑफ द स्किन, ब्लड वेसल इंक्रीज हीट लॉस एंड स्वेटिंग, इवेपोरेशन, कूलिंग, डिक्रीज मसल एक्टिविटी. व्हेन वास्कोडाइलेशन में ड्यू नो क्या होता है, मतलब कंस्ट्रक्शन में तो यू कैन से जो वीन्स होती है वो कंस्ट्रक्ट हो जाती है बट डायलेट हो जाती है. जो हमारी वीन्स होते हैं वो डायलेट हो जाती है, जैसे फ्री मूवमेंट ऑफ वो होने लगता है ब्लड, तो उससे जैसे कि हम प्रमोट कर सकते हैं बॉडी का हीट. वो व्हेन बॉडी इज कोल्ड वैसो कंस्ट्रक्शन हो जाता है. लाइक इन विंटर्स वी हैव नोटिस दैट जब हम ठंडियों में साइकिल वाइकिल चलाते हैं तो मतलब रेडिश फेस हो जाता है. दैट बिकॉज ऑफ वैसो कंस्ट्रक्शन ऑफ द स्किन. Shivering heat, increase heat production, reflexes. Now let's see the factors affecting body temperature. So it's mainly 7 factors which we are discussing: age, diurnal, its cardiac rhythm, exercise and muscle activity, hormones, emotional stress, environment, food and drinks. So age, like infants and elderly have less stable temperature regulation. Like जो infants होते हैं उनका body नहीं regulate करते हैं पाता है body temperature, and elderly जो हमारे old हो गए older peoples उनका body भी नहीं regulate कर पाती है body temperature को. Diurnal, like cardiac rhythm, temperature is the lowest in early morning. Like मॉर्निंग में टेम्परेचर एकदम लोवेस्ट पे रहता है, बट हाईएस्ट आफ्टरनून में हो जाता है, और वी कैन से इन इवनिंग. नाउ लेट exercise and muscle activity increase body heat. Like when we do exercise, so it's very obvious जब हम exercise करते हैं तो हमें sweating होती है, we feel hot. And hormones like progesterone increase temperature during ovulation. Like females must have noticed that during the ovulation phase, when egg is being released, they slightly increase in temperature, they have noticed. Emotions increase heat production by sympathetic activity. And emotions and stress, that's the environment. Hot or cold surrounding affect the body heat. Like when we go to cold surrounding, our bodies try to maintain the temperature and it's become cold, and when we go to hot temperature, our body try to gain, so it try to become cool. Food and drinks, hot or cold intake temporarily alters the temperature. Now let's see. So in short we can say definition of temperature: balance between heat production and loss. In physiology we see heat is produced by metabolism, muscle activity, lost by radiation, conduction, convection, evaporation, and regulated by hypothalamus, regulates by vasodilation, sweating, vasoconstriction and shivering. And factors we have discussed. Now let's see equipment used. So what are the equipment used for measuring temperature? That's clinical thermometer, mercury in glass, जो कि हमने देखा है clinical thermometer जिसमें मरकरी भरी होती है. एंड डिजिटल थर्मोमीटर मोस्टली सबके घर पे यूज़ होता है. इलेक्ट्रॉनिक थर्मोमीटर विद डिस्पोजेबल प्रोब्स कवर. एंड वी हैव इंफ्रारेड थर्मोमीटर्स, disposable single use trap thermometers. Techniques of measurement, how we can measure oral temperature. For oral temperature we have to wash and explain procedure. Place thermometer under the tongue, lips closed, lips should be closed, leave for 2 to 3 minutes and until it's beep. When thermometer beeps means we have taken the reading, have came. Record reading immediately. Now rectal temperature, wear gloves, lubricate thermometer tip. We have to lubricate, properly lubricate, because we have to insert it into the rectum. Then we have to insert it gently 2 to 3 centimeter in adults and 1.5 to 2 centimeter in infants. Make sure to write these, this is very important, and hold in place for 2 to 3 minutes. And for axillary temperature, place the thermometer in a dry axilla. First we have to clean the axilla. Hold arm and close to body. Leave for 4 to 5 minutes mercury until it's beep. Record. Now tympanic, use a probe cover, gently insert into ear canal. Press button, reading appears in seconds. टेम्पोरल, प्लेस स्कैनर ऑन फोरहेड, मूव. इमेली आपने कोविड में देखा होगा, ये हमारे फोरहेड पे ऐसे प्लेस करते थे. इट्स लाइक समथिंग गन टाइप्स होता है, वो ऐसे प्लेस करते थे एंड रीडिंग आ जाती थी. दैट्स टेम्पोरल टेम्परेचर. Now let's see nursing concentration. That always use a clean thermometer with a probe cover. Wait for at least 20 to 30 minutes after eating, drinking or smoking before oral measurement. Record site, method and time, like temperature. Report any abnormal reading promptly. Now according to the syllabus, let's see what is hyperthermia. Hyperthermia, an abnormally high body temperature due to body's inability to lose heat adaptively. जब हमारे बॉडी का टेम्परेचर बहुत हाई हो जाता है, सो दैट्स हाइपरथर्मिया. ये कैसे होता है? जैसे हॉट वेदर में बहुत ज़्यादा हमारी बॉडी वार्म हो जाती है और बॉडी जो हीट होती है वो उससे वो रेगुलेट नहीं कर पाती है. कॉज हॉट वेदर, एक्सेसिव एक्सरसाइज, डिहाइड्रेशन और फीवर. सिम्टम्स या फ्लश्ड स्किन, स्वेटिंग, रैपिड पल्स, हमारी पल्स रैपिड हो जाती है, डिजनेस फील होने लगता है, वीकनेस. एंड नाउ लेट्स सी हीट क्रैम्प्स. दीज आर पेनफुल इनवॉलंटरी मसल स्पैम्स दैट अकर आफ्टर इंटेंस एक्सरसाइज इन हॉट एनवायरनमेंट. सो ये क्या होती है कि ये बहुत ही पेनफुल और इंटेंस, मतलब एक ही साथ मसल्स जो हमारे एक साथ कॉन्ट्रैक्ट करने लगते हैं जब हम इंटेंस एक्सरसाइज कर लेते हैं हॉट एनवायरनमेंट में. कॉज क्या है इसका? मतलब लॉस ऑफ इलेक्ट्रोलाइट हो जाता है, जैसे सोडियम, पोटेशियम एंड फ्लूइड थ्रू स्वेटिंग. सिम्पटम मसल पेन, स्पाम्स, कॉमनली इन लेग्स. वी हैव नोटिस इट जब हम लोग एक्सरसाइज करते हैं मोस्टली. गर्ल्स जो स्लिम होने के लिए करते हैं, मीन्स थाइज या स्टमक बेली फैट रिड्यूस करने के लिए, तो जब स्टार्टिंग में 1-2 days वी डू, so we have cramps in our legs and that's heat cramps or abdominal heavy activity. Now we have heat exhaustions, that a mild form of heat related illness caused by fluid and salt depletion. जब हमारे बॉडी में हीट रिलेटेड इलनेस हो जाती है, क्योंकि किस वजह से, जब हमारी बॉडी में फ्लूइड या साल्ट की कमी हो जाती है, कॉज होता है प्रोलॉन्ग एक्सपोजर टू हाई टेम्परेचर एंड इनएडिक्वेट फ्लूइड इंटेक। जब हम लोग बहुत देर तक गर्मी में रह लेते हैं या कम फ्लूइड का इंटेक करते हैं। सिम्टम्स आर प्रोफ्यूज स्वेटिंग, बहुत ज़्यादा स्वेटिंग होती है, वीकनेस, चक्कर जैसा लगता है, डिजनेस, नॉजिया, वी फील लाइक वॉमिटिंग, हेडेक, रैपिड पल्स, pale and clammy skin. If untreated, can progress to heat stroke. So what is heat stroke? So heat stroke is a medical emergency condition defined as the most severe heat related disorder where the body temperature rises above the 40 डिग्री सेल्सियस के above हमारा body temperature हो जाता है और हमारा thermo regulation mechanism fail हो जाता है। That's condition known as heat stroke. Cause होता है prolonged heat exposure, strenuous activity in hot climates. Symptom very high body temperature, hot and dry skins, confusion, agitation, seizures, loss of consciousness. What are the complication? Organ failure, death if untreated. Requires immediate cooling and emergency. Hypothermia, as the name suggests, hypothermia, a condition where the body temperature falls below 35 degrees Celsius due to excessive heat loss. What are the causes? It's like prolonged exposure to cold weather, immersion in cold water, inadequate clothing. Symptoms are slow pulse and breathing, weakness, drowsiness, loss of consciousness in severe cases. If left untreated, can lead to cardiac arrest and even death. So now let's define fever or pyrexia. It is an abnormal elevation of body temperature above the normal range due to resisting of the hypothermic outermost and usually in response to infection or inflammation. जब हमारी बॉडी में इन्फ्लेमेशन या इन्फेक्शन हो जाता है तो हमारी बॉडी उसे कोप अप करने की कोशिश करती है, सो इट इंक्रीज द टेम्परेचर। इट्स नॉट कि फीवर हो रहा है, फीवर इसलिए हो रहा है क्योंकि अंदर कोई डिसीज़ हो रहा है, बॉडी इज ट्राइंग टू फाइट infections, inflammation से। It is a defense response to the body against disease causing agent. Now let's see the causes of fever. Infection हो गया like bacteria, pneumonia, TB, typhoid, virals like influenza, dengue, COVID-19, parasitic infection like malaria, inflammatory conditions like arthritis or autoimmune disease, malignancies like leukemia, lymphoma, heat related like heat stroke, drug induced like certain antibodies, anti-cancer drug, others like tissue damage, trauma, surgery,